Hello everyone, I am Dr. Muzamil Liaqat Ali, and in this lecture we will discuss magnesium, the fourth most abundant cation in the human body and the second most prevalent intracellular cation. We will cover this topic by having multiple facets like it's we'll cover its distribution, functions, clinical abnormalities, and requirements. So, in a quick session, we will, sum up all these, headings. So let's begin with the body distribution of this pretty mineral or the electrolyte. Magnesium is the fourth most common or abundant cation in the body and the second most prevalent intracellular cation after potassium. The total body magnesium content is about 25 grams. So this is distributed as follows. 60% is complex with the calcium in the bones where it distributes, or where it contributes to the bone structure and serve as the reservoir. The 1/3 of the skeletal magnesium is exchangeable with the serum, meaning it can be mobilized when needed. The remaining portion, the remainder is found in the soft tissues and intracellular fluid. Let's come to the sources of magnesium. What are the dietary sources of potassium? This may include the cereals, beans, leafy vegetables, fish. It's a wide range of sources. You can include the spinach, almonds, Brazilian nuts, black beans, sunflower seeds, pumpkin seeds, and green herbs and baked potatoes and this, and along with the skin, and the 70% plus of the, in dark chocolate. These are the, there's a wide range of the sources of the magnesium. So magnesium is present in mainly, as we just discussed in plant foods, but refining and processing can significantly reduce its content. Whole grains are therefore better sources than refined grains. Let's come to the absorption and excretion of the magnesium. Absorption. Magnesium is absorbed in the small intestine with the efficacy, with the efficiency of absorption varying depending on the dietary intake, and the body stores. What about the excretion? Magnesium is primarily excreted by the kidneys. It is reabsorbed from the loop of Henle in the nephron and not from the proximal tubules. This means that the loop of Henle plays a critical role in the magnesium conservation. Let's come to the function of the magnesium. Magnesium performs several essential functions. Very first one is it serves as an activator for many of the enzymes that require, ATP. This may include alkaline phosphatase, hexokinase, fructokinase, and phosphofructokinase, a key regulatory enzyme in glycolysis, along with adenyl cyclase, which produces cyclic AMP and CAMP or cyclic AMP dependent kinases. Secondly, magnesium lowers neuromuscular activity or irritability. It acts as a natural calcium channel blocker, reducing the excitability of the nerves and the muscles. This is why magnesium sulfate is used to treat eclampsia, a condition characterized by seizures in pregnant women. Next is the insulin-dependent uptake of glucose is reduced in magnesium deficiency. Magnesium is required for the proper insulin signaling, and magnesium supplementation improves glucose tolerance in individuals with diabetes and insulin resistance. As you can see on your screen, there's a wide range of functions. As it is involved in bone structure, energy production, RNA, DNA synthesis, glutathione synthesis, blood sugar control, blood pressure regulation, muscle contraction, nerve function, essential for the regular heartbeat. Let's come to the normal levels of magnesium. The normal level of serum magnesium is 1.8 to 2.2 milligrams per deciliter. Inside the RBCs or the red blood cell, the magnesium content is about 5 milliequivalents per liter. But in muscle tissues, magnesium concentration is approximately, bit on a higher side, that is 20 milliequivalents per liter. Of the magnesium in the serum, 70% is in the free state, the ionized state, right? Which is the physiologically active form of the magnesium, while the remaining 30% is bounded to the proteins, with 25% bound to albumin and the remaining 5% bound to the globulins, right? We've discussed the normal levels of serum. What about the levels below 1.8 milligrams per deciliter, and what about the levels more than 2.2? We can classify the deficiency or excess disorders as the low levels below 1.7 milligram per deciliter as a hypomagnesemia. And the causes of hypomagnesemia may include the vomiting, diarrhea, liver cirrhosis, protein calorie malnutrition, diuretic intake, or diuretic therapy, as many diuretics increase magnesium excretion. As you can see on your screens, the mnemonics for the hypomagnesemia is named as starved, right? STARVED, right? S for seizures, T for tetany, A for anorexia or arrhythmias, R for rapid heart rate, V for vomiting, E for emotional lability, and the D for deep tendon reflexes increased. What about the treatment options for the hypomagnesemia? Oral magnesium therapy may lead to diarrhea, which can worsen magnesium loss. Therefore, intravenous magnesium sulfate is often given to correct severe hypomagnesemia. Hypomagnesemia. Let's come to the hypermagnesemia, the increased levels. And the level more than 2.2 milligram per deciliter that you can label as a hypermagnesemia. And the causes may include the excess intake of oral or parenteral intake of magnesium, such as with the magnesium containing antacids and laxatives. Next is the renal failure, where the kidneys cannot excrete magnesium. Next may include the hyperparathyroidism, oxalate poisoning, rickets, multiple myeloma, dehydration, and some of the drugs like glycosides, antacids, and calcitriol intake. Right? As you can see on your screens, the mnemonics may include the MSHBRNE, maintenance saline health body reach normal electrolyte levels. So mnemonics would be MSHBRNEL, right? The muscle weakness, skeletal muscle contraction, hypotension, bradycardia, respiratory distress, vomiting, or the nausea, excess nerve function, and L4, the loss of deep tendon reflexes. Let's come to the daily requirement of magnesium. About 400 milligrams per day in men and about 300 milligrams per day in women is required, in a regular, intake, or should be present in your diet, whatever the mode of intake, it should be present in your diet, right? By any means, right? 300 for the woman and 400 for the men, right? And you already know the dose more than 600 milligram per day can cause diarrhea. More magnesium is required during lactation to support the needs of both mother and the infant. So to summarize, let's chalk out its key points. Magnesium is the fourth most abundant cation, with the total body content about 25 grams in a normal individual. Major sources may include the cereals, beans, leafy vegetables, the fish. And what about the function? It acts as an activator of many of the ATP requiring enzymes that lowers the neuromuscular irritability and improves glucose tolerance rate. Normal levels are 1.8 to 2.2 milligram per deciliter, and the levels below 1.8 milligram per deciliter that we label as a hypermagnesemia occurs with gastrointestinal loss, diuretic use, and malnutrition. And the levels more than 2.2 milligrams per deciliter that you label as a hypermagnesemia occurs in renal failure and with excess intake. And the daily requirement for the men are 400 milligram and 300 milligram for the women per day. Thank you very much for listening. In our next lecture, we will discuss iron in pretty much in details. Thank you.